Ebola is spreading rapidly in the Democratic Republic of Congo, with health workers warning that the response is struggling to keep pace. As of July 22nd, the DRC has reported 2,473 confirmed cases and 999 deaths. The outbreak is largely concentrated in eastern Congo, with cases reported across multiple provinces. Ituri province remains the main epicenter, with the city of Bunia among the key areas at the center of the response. Cases have also been reported in North Kivu and South Kivu. The outbreak has crossed borders, with Uganda reporting cases linked to transmission from the DRC. The outbreak is caused by the Bundibuyo Ebola virus strain. Now, it's a strain for which there is currently no approved vaccine. The virus spreads through direct contact with bodily fluids or infected people or contaminated materials.
There are places where you have one community death in a new area, and in a few days you have 17 new cases. It's such a great example of how infectious anyone is that stays in the community as soon as they have symptoms. So if we don't have proper surveillance in place, if we're not able to monitor every single person that was in contact with a confirmed case, every single person that's at risk of developing the disease, if we're not able to monitor this, the outbreak will continue.
Armed conflict is making the Ebola response more difficult as it gets tougher to transport laboratory samples and reach affected communities. Attacks on health facilities and response teams have further complicated efforts to contain the outbreak. While the response is also facing a shortage of active health workers, some health workers have gone on strike over unpaid salaries, disrupting critical response activities, and another major challenge is the number of people who are dying before reaching treatment centers. Health authorities and aid groups are now calling for a stronger international response amid the crisis, which continues to put pressure on local health systems. Africa CDC has warned that the outbreak could become one of the worst Ebola outbreaks ever recorded if transmission is not contained.